Hi, Alvin DeLeon here, and you are watching episode 20 of the 3-Minute Health Tip. In this episode, I'm going to discuss children's fears. Children who are exposed to an unexpected conflict shock that they subconsciously and subjectively perceive as a fear will create symptoms such as a cough, a bronchitis, or a laryngitis. And a lot of times we hear parents describe that their child will only get their symptoms at night before bed. That's when they have these coughing attacks. And so one of the things that we have to be aware of is that, again, depending on the age of your child, different children can have different things that can create a fear in them. And remember, the key point here is that it has to be unexpected. And so if it's a child or a toddler, we talked about in the past, unexpected changes in routine could create a fear, right? Somebody else babysitting them, somebody new, a new environment that they're in that they're not comfortable with could create a fear. In the evening time, create a cough for that child. As they get older, though, you can start to pay attention to some of the things in their environment, or you can talk to the child directly. And one of the things that we've discovered with many children is that some of these fears could be just things that seem totally mundane and totally innocuous. You know, we had a child that the parents realized would have his coughing fits every time they were getting in the car at night. You know, so he was scared of being in the car in the dark at night. Recognizing this and giving him a nightlight to be in the car whenever they were coming home in the nighttime helped alleviate some of the child's fears, and his coughing symptoms started to subside. This could be the same case where you have a child all of a sudden afraid to sleep in his room or afraid to go to bed at night, and you start to recognize this because they start to have coughing fits. Well, you have to look at really some of the things that they're seeing. A lot of the times there's commercials on TV, particularly late at night, that have to do with horror movies. And depending on the age of your child, if they don't have the maturity to understand what they're seeing on the screen, blood, people screaming, that's enough to create a fear in the child. Also, you have to be conscious of your communication as the parent. A lot of the times that we've heard children getting scared and having these cough symptoms after visiting their grandparents, and everybody was at the dining room table talking about somebody that was on the news that got kidnapped, or somebody that their house was broken into, or someone that was murdered or killed. And so we have to be really conscious of what we're discussing around our children. Not to say that every child that hears these discussions are going to be scared, but as a conscious parent, we're going to start to recognize which child will tend to present a symptom after hearing about one of these incidents in the neighborhood or in the news. So I hope that those parents out there that are dealing with children with chronic cough episodes, you start to look at some of the things we discussed here. Is it something that they're seeing on TV that's scaring them? Is it something that they're hearing that the adults in their life are discussing around them that's scaring them? And your ability to sort of help them make that connection and create a safe environment will go a long way in helping them to overcome their fears and overcome their coughing symptoms. I hope that health tip was valuable, and I look forward to seeing you at the next episode.